We all dream of one day retiring and living a full, healthy, active life. So what can you do to make that dream come true? Well, Dr. Laura Murray is an internal medicine physician and medical director for Cone Health. She's here to talk about healthy aging. People hear about healthy aging and longevity, but what does that really mean?
I think when you ask most people, what they would say is that it's really more about finishing their last chapters with the kind of mental clarity and strength and mobility and connections, meaningful connections that allow us to be independent and really enjoying our life right up until the end, and less about the number of years. I think we all think about it as being a number, but really when you talk to people, it seems to be more about finishing the way you want to finish.
When I think about that,
enjoying those last years.
I think about my great-grandmother who was in her late 80s and still gardening every day. She even killed a rattlesnake out there in the yard. She was
Wow.
a whipper-cracker up to the end. What do we need to do to be like her?
Well, like everything else, the devil's in the details. It really turns out to be more about healthy habits. And when do you start with that, right? So the sooner that you can start with healthier habits, like getting some movement, getting some moderate intensity exercise, which sounds simple until you go to execute on it. But what does that look like, right? Could it be taking a walk every day, doing a little bit of strength training every day? A couple of times a week, do you lift a couple of weights? Knowing what your numbers are. So, it's really basic block and tackling, but keeping your blood pressure controlled, trying to keep the weight from piling on, knowing if your cholesterol or your blood sugar are a problem, and then staying engaged, right? How are you connected to people? How do you find purpose in your life? And those seem to be really the big drivers, and it's all in the habits that we establish a lot earlier than we think we need to.
When you say a lot earlier, how early do people need to start worrying about this stuff?
So I think a lot of people think that it might be, starting when you're about 70, right? When you're older. But honestly, it starts way upstream from that. So if you can start when you still feel good, right? In your 20s and 30s, in your midlife for sure. It's never too late to make a difference. But the earlier you get upstream of some of these things and lay down some of the habits that will be sustaining, the better.
Okay, someone in their 40s watching right now, what is one thing they should change so they age healthier?
Man, the first thing that I would start with is movement. Do something movement related every day. And that could be taking a walk. It doesn't have to be fancy like going to the gym. It could be just making sure that you're getting up and moving around in some kind of structured way.
What about sleep? We always hear that the key to a long, happy life is getting sleep. Is that really important?
I think that's true, yes, because running on empty all the time is no kind of plan for success. And so it seems simple, but it can be hard to do, and that's why we put the intentionality into it now, when we're even not waiting until we're 40, but getting as far upstream of that as we can. But yeah, going to bed at a reasonable hour and getting a reasonable number of hours of sleep so that you feel rested and refreshed. I think there's a lot of variability about what that number is, but 6 or 8.
At least 6, though. That's tough, but we can do it. Hey, is there anything that can predict who's actually going to live until their 80s and beyond?
I think there's a lot of material out there, and none of it's really solidly proven. What we do know is that people who optimize their optimizable risk factors, so people who are managing exercise, who are managing rest, who are building healthy connections and a sense of purpose in what they do with their days. And then, knowing your numbers, right? If you've got high blood pressure, take care of it. See somebody, get something for that. And cholesterol, make sure that you know your numbers, make sure that they're being managed, because if they're high, they're a strike against you, right? And so if we can do anything about that, let's be doing it. Blood sugar, let's be sure we're taking care of that. Not easy, but it is basic, right? It's in those habits.
At what age do we need to start going to the doctor to get all these numbers checked?
Well, I think you should start young. You should start way younger than you think you need to, because it turns out that if your blood pressure is a little bit high starting in your 20s, but you wait a lot of decades to take care of it, that has an impact. And so it would have been better if you knew. And so I would say that people ought to be going to their, that's where health systems play a role in partnering with you and identifying things that could be managed earlier and give you a better outcome. So I would say, we see kids routinely when they're young, and there's a reason for that. And we should start when we're adults. That doesn't mean you're going to have a condition that causes you to need to go all the time, but you should go and find out.
Never hurts to get checked up. Thank you so much for all this great advice. Stay with us because we're going to talk more on the other side of this break about how to live a long and healthy life.